Indianapolis Colts QB Andrew Luck has already been ruled out for Week 3 of this NFL season and has not yet returned to the practice field following his shoulder surgery this offseason 8 months ago. Time now for an injury report presented by Midwest Orthopaedics at Rush, the 5th-ranked orthopedic group in the nation. It's how orthopedic care should be. We welcome in sports medicine and orthopedic surgeon Dr. Nikhil Verma to discuss Andrew Luck's status. Doctor, how concerning is Luck's lack of progress coming off this shoulder surgery?
Yeah, certainly a lot of mystery surrounding this one, isn't there? So when he had the surgery back in January, it was billed as a fairly uncomplicated labral procedure, and certainly labral tears in the NFL are fairly commonplace. We typically expect people to be back or players to be back about 6 months after the injury, maybe a couple months longer in the overhead thrower, such as a quarterback position. However, we're now about 9 months after the surgery, and we haven't even seen signs that he's throwing yet. That certainly would suggest to me that he's a number of weeks away at best, and certainly would raise some concerns about maybe there's a complication or an ongoing issue with that shoulder that may require some form of further treatment or intervention.
Well, after hearing that, Dr. Verma, I would suggest that any fantasy player currently rostering Andrew Luck cuts ties and fills that roster spot with someone who can make an impact right away. Without knowing when Luck will return, that's just too much of a gamble to hold a roster spot for someone who may give you absolutely zero impact. If you need to fill that spot with another quarterback in 2 QB leagues, go look near the bottom of the league for a starter like Jacoby Brissett or Deshaun Kaiser or Jared Goff. At least those players will give you something, whereas right now Luck is giving you absolutely nothing. Thanks again, Doctor. This injury report was presented to you by Midwest Orthopaedics at Rush, the 5th-ranked orthopedic group in the nation. It's how orthopedic care should be.